Surgery may not be the best option for prostate cancer. I'd like to describe some alternatives. Many people aren't aware of all the excellent alternatives to surgery. When people think of cancer, they think of removing it through an operation, and that's a very logical conclusion if we're talking about lung cancer or gallbladder cancer. With prostate cancer, there are many reasons to think that maybe surgery is not the best option, primarily because of the location of the gland. It's very difficult to reach down inside the pelvis, and right next to some very important things, such as the urinary bladder, the rectum, and most importantly to us guys, the nerves that control erections. So statistics indicate that even at the finest centers, about half of the men that go through prostate surgery become impotent. And there are other tragic things that I'm not going to go into in detail, but aren't there some other choices besides surgery? You sometimes don't even hear about these because in the prostate cancer world, urologists, who are surgeons, are usually the ones that are explaining all this. So surgery is always sort of put front and center as the first choice. So what are, just briefly, some of these other choices? Probably the most mainstream and standardized is something called a radioactive seed implant. And this requires skilled physicians, radiation therapists, rather than a urologist usually, although some urologists have learned to do this. And it's an outpatient procedure. Men are placed on their back, and needles with little tiny radioactive seeds are threaded into the prostate. And these radioactive seeds remain in there, radiate the gland, and cure the cancer. The cancer cure rates are actually slightly better than surgery, and the risk of erectile dysfunction is lower than surgery. So it's a win-win option as long as the center doing the treatment knows what they're doing. Other forms of radiation are consideration. There's a whole laundry list of them: proton therapy, CyberKnife, IMRT, and actually the similarities are greater than the differences between these different options. And shopping for a center of excellence is the most important consideration. Lastly, new experimental focal therapies are starting to come on the scene, where instead of destroying the whole gland, men can aim to simply eliminate the cancer within the gland. Logically, that's going to have a lot fewer side effects, and the cure rates on initial studies look quite good. However, like any new thing, this is not completely proven, and we eagerly await the results of studies that are ongoing.
Some prostate cancers are high risk, aggressive, and more likely to spread. Others are low risk, least likely to have bad outcomes. The biopsy says cancer, but current diagnostic tools provide limited information about how aggressive a man's individual disease is. So most men decide to treat prostate cancer immediately. Once treated, many men experience serious long-term side effects, like incontinence and sexual impotence. Immediate treatment isn't always needed, but right now a man can't be sure if his cancer is the kind that is likely to require treatment or if he's okay to wait for now. What if there was a test that could determine how aggressive prostate cancer is? Genomic Health is developing a new test to do just that. By reviewing the underlying biology of the tumor and using genes from multiple biologic pathways, the test can predict the aggressiveness of prostate cancer when diagnosed, allowing a man to make a more informed treatment decision with confidence, taking care of himself with more information and greater peace of mind.